Good afternoon, everyone, and thank you for coming. It's my pleasure to be here with you today. My name is Cate Dewey, and I'm the director of the One Health Institute. And I've been asked just to say a few words about the One Health Institute and One Health at the University of Guelph. And I could go on for half an hour, but I'll try hard not to do that. The mission of the One Health Institute is to enhance and promote academic research and outreach in One Health to propel the University of Guelph to the forefront of One Health internationally. Maybe you already know this, but we have two staff members, Catherine Phelan and Pete Kelly. They're program managers with us, and they do a phenomenal job. And from a governance perspective, the Dean of the Institute is Jeff Witchell. He's the Dean of OBC. Jane Parmley, I highlight because Jane is in the room somewhere. Thank you, Jane. And Jane is a faculty member in population medicine who comes to our weekly meetings on an every other week basis and really brings a lot of really great perspective to our meetings, and so I really appreciate her. And then the advisory board has a faculty member from every college on campus. We have faculty members in every college that are involved with the One Health Institute. And actually OHSC has two, because we have one faculty member from Ridgetown as well. And the reason that that's important is because we have a very broad approach to One Health on our campus. The One Health Institute, we have institutes and centers on our campus. These are typically virtual institutes or centers, and it's just a way to say that we're doing a focus in research and teaching and on a specific topic. There's lots of institutes and centers. And we were officially started in 2019. We have a website, and that's just a couple of images from our website. One of the things I think that's a strength of the website is it shows affiliated faculty members with their areas of expertise, and it's been set up by Pete Kelly so that it's a searchable website. So if you're interested in anything in particular in One Health, and you can search that, and you'll find the faculty members who are working in environment or viral diseases or poultry or whatever. And there's also an opportunity through the One Health Institute for funding for undergrad, summer research students, and also graduate student funding. Those funding opportunities all start with the faculty member applying for money, just so that you know. So faculty members apply for money, they're selected amongst those that apply, and then they will send out a notice that they're looking for a summer student or a graduate student. And those calls typically, for the summer students, typically come out in January, February, and then it'll be announced on the One Health Institute website that that there's opportunities for summer students if you're interested. We have a vibrant One Health community practice, and I think that that's one of the most important things that the One Health Institute does. We highlight research that's happening at the University of Guelph through the One Health seminar series. Some of that seminar series is organized by Jane Parmley, who teaches one of the graduate courses, and other seminars are organized by the Institute. Several of the presentations that have been given by faculty and people outside of the university have been recorded, and they're on our YouTube channel. As I said, that there are faculty information on our website, so there's a list of more than 150 faculty who are affiliated faculty members, and you can read about what they do for their research on a high level. And then some students have interviewed faculty members and graduate students and written easy to read short summaries of the research so that you can have an idea of the range of research that's happening on campus. And you're going to be hearing about the One Health Student Committee shortly, but we support the One Health Student Committee when we can. If you're interested in following more information about the One Health Institute, I would really encourage you to participate in one of these. So you can come and look at our website if you like. There's a bi-weekly newsletter that goes out by email. You're welcome to sign up for that. Pete Kelly is very active on Twitter. We have 4,000 followers. We are also on LinkedIn and Instagram. So the Institute was granted some funding in order to get started, and with that funding, 3 faculty members were hired: Heather Murphy in OVC, Diana Lewis in the College of Social and Applied Human Sciences, and Quim Weber in the College of Biological Sciences. And I've just mentioned a few others. There's many There's many faculty members on our campus who were specifically hired as One Health faculty members. And these include Travis Stephens, Katie Clow, Jane Parnley, Nicole Ricker, and others. And although Larry Goodridge was not hired as a One Health faculty member, his work in food and foodborne diseases and water and water as a sentinel, at least as an opportunity to identify diseases including COVID-19, is a very strong One Health researcher as well. So there's many others, and again, you'll find them on our website. But you can just see in the words that I put beside the faculty members, there's quite a wide range of research projects that people do. One of the things that I'm most proud of, and I had nothing to do with, so I guess I can be proud of, is our innovative academic programming that we have on this campus. We have a collaborative specialization in One Health for master's, PhD, and DBSc students, and I'm going to have more information on the next slide about that. But one of the exciting things is we have 19 departments participating, and so far we've had 29 students either enrolled or graduated from that program. A Doctor of Veterinary Medicine MPH program. So students who graduate from a DVM at OVC are welcome to enroll in the Masters of Public Health program the year they finish their DVM, and instead of it being a 2-year program, they can complete that program in 1 year because they've taken some courses during their DVM program that are related to One Health. And the Bachelor of One Health that was led by Brian Husband, who's in the back corner, and it's a very innovative program that involves 8 departments and 4 colleges. It's a unique program that enables students to pick an area of emphasis: disease complexity, environment and food, policy and economics, or culture and society. So I have this other slide on the collaborative specialization. And so what happens in this is somebody will perhaps get a PhD in food science or political science or history. If their project is a One Health project, they're welcome to sign into the collaborative One Health program. They take 2 courses, graduate courses in One Health. And what we believe our graduates are going to finish with, whether they're a graduate student, master's or a doctoral student, or if they're an undergrad, we believe that they'll graduate with the ability to have critical thinking, to work in a team, to show leadership, to understand health in a very holistic manner. And these are attributes that employers are looking for. The Bachelor of One Health, just one more slide on it. There are work opportunities built into the program for co-op placements and One Health capstone course that will include people from all streams. Interestingly, the International Livestock Research Institute that is in Kenya, in Nairobi, and has centers for research around Africa and Asia, has already contacted us and asked when our students will be available for co-ops, because they're looking to hire our co-op students. One of the things that's been exciting about the One Health Institute is is connecting with people across Canada and around the world who are interested in what we're doing. Maybe they're wanting to set up a One Health Institute, or they want to work with us as the One Health Institute. And just an example, because there's lots of them, but Mississippi State, they brought a group of students this summer and spent a week with us. And BRAPA in Brazil, that's a research organization funded by the government. University of Zurich, this summer we had several universities from India coming to find out what we're doing on One Health and wondering how they can participate. This summer we held a policy fellowship where we worked with people working in the government and also conservation authorities interested in learning how to work at learning about One Health and how to use One Health in their everyday work. This is ECCC, that's Environment and Climate Change Canada, Canadian Food Inspection Agency, Public Health Agency of Canada, Ontario Ministry of Health, and several conservation authorities. And so it was a really exciting opportunity to have people from multiple organizations talk about that. We're in the process right now of creating some micro-credentials. Those are going to be educational opportunities for people who are in the workplace, but it's not a university level course, it's a continuing education. We've done a lot of work building research teams across this university, so when there's a call for a research project, we will bring researchers together who are interested in that particular project. So maybe we'll bring soil scientists with animal scientists together. We might bring in people who are in the social sciences who know about how best to communicate research results, but also impact behavior change in humans. And we'll put these teams together so that we're actually approaching a project with a One Health approach. And last year there was an OMAFRA call, and 9 new research teams were built for that particular call, as an example. We're participating in 4 community projects in sub-Saharan Africa. These projects are meant to reduce zoonotic diseases and improve the lives of women and girls. And we've got 12 faculty across the university working on those projects, and they are going to be starting in the next few months. And so there may be opportunities for students to participate in those. So thank you very much for your attention, and I'm going to pass it over to Simon, who will talk about the student committee.
Everyone can hear me okay, hopefully? Great back there, awesome, okay. I can definitely say I've never had 2 mics on at the same time, so this is really cool. I feel very important. But first of all, I'd like to thank you for coming today, everyone who's here and everyone who's online with us as well, and also extend a thank you to the organizers of today's event. This is really cool, a really great way to start the year, especially in terms of One Health Institute, and us. We are the One Health Student Committee. My name is Simon Jeeves. I'm one of the co-presidents for this year's executive. Today I'm going to talk to you a little bit about who we are, what we do on campus, and what we hope to achieve, and what we're going to be looking at this year. For events planned, and also going down the road of some networking opportunities and things of that sort. So the One Health Student Committee was founded in 2019, shortly after the One Health Institute, by multiple members of the Department of Population Medicine of OBC, Pathobiology, and DVM students. Since then, we've grown to a team of about 23 to 25 executives each year. So quite a large student organization. We pride ourselves in being able to spread workload very evenly and tackle a lot of events at the same time. I'll break down kind of our structure for you. We are housed in 3 different sub-teams, subcommittees, if you will. First and foremost, definitely operations, who handles all of our internal affairs, so primarily communications. That's our social media, our listserv, which I can say very happily we reach about 600 people, whether that's locally or from different institutions in Ontario, different institutions across the country, and also some institutions internationally as well, which is really exciting. That listserv continues to grow, and we really appreciate the reach that it has for our student committee. Of course, also we have our website where you can find pretty much everything that we're doing and what we're up to. Some things that I'll talk about in just a second as well. Operations also handles all of our finances and treasury type activities. And lastly, all of our official business, all of our internal affairs, so things like being an officially accredited CSA organization, which took a lot of work. And very happy to say that last year we officially became accredited on campus, and we're looking at continuing that trend for years to come. Moving over to the middle, we have our events team who really focuses on our two major events that we would run each year. Last year, we had the opportunity to work with OHI and also with the One Health student organization at Western University to run the One Health Research Day, particularly the What is One Health segment of that day, which was really, really exciting. It was kind of like a mini research symposium. It was really great to see everyone come out and see research presentations from multiple institutions across Ontario. Really, really neat stuff. Our other major event every year that we run, outside of the academic year actually, somewhere between late spring and early summer, is the Exploring One Health seminar series. So that's an online-based series that we've run for several years now with a great amount of participation locally as well as internationally. Last year we actually had participants from 10 different countries. Here in Canada, United States, Europe, multiple countries in Africa and Asia as well. It was really, really exciting. That's something that we really pride ourselves in, is our reach. The people that we can engage and contact worldwide, really, and educate people on what One Health is, what we can do in our everyday lives, whether that's research or the workplace, to engage and promote One Health. And of course, lastly is our outreach, something else that we take a lot of pride in. We're a very multifaceted organization, but we definitely try to have a focus on outreach when possible. So community outreach, things like fundraising and charitable work that we do is really foremost for us as an organization, whether that's on a university level or on a local scale in Guelph and neighboring communities, or on a national level or international level as well. So that includes things, like I've said, like charitable work and fundraising, as well as networking opportunities, social events for students on campus, now especially this year and last year with our Bachelor of One Health students who are here, and we're so happy to have them all. And yeah, so that's kind of how we are structured. Like I said, somewhere between 20 and 25 executives every year. It's a lot of fun. I've been on, this is going to be, I believe, my 4th year, and it's been a really great time every year so far. So I'm going to take you back a little bit and talk about some of the things that we've been able to do, kind of where we have been in the past and in our history. So since 2019, when we were founded, we take the time to run multiple types of events every year. Like I said, it's a mix of different things, and you can see on the slide a bunch of different things that we've done, mainly in the last year. This is just graphics we have from the last 12 months or so. Like I said, last year, when we did the One Health Research Day in collaboration with the Western One Health students, we also did another collaborating event, the Unite Case Competition, which was really cool. I've never been part of a case competition type event before. It was a lot of fun to plan, a lot of fun to carry out, which we held at Western. It was greatly attended as well. It was a lot of fun. We, of course, run journal clubs, research bite events, and networking nights where people can come and meet One Health faculty, One Health experts in governmental organizations, NGOs, and elsewhere. People can learn about, what One Health research is being done locally, what One Health research is being done on campus, campuses across Ontario, campuses across the country, or different governmental organizations as well. I also have the bottle drive in the middle there. That's kind of a recurring charitable event that we run. It's super easy. We were founded during the pandemic, so that was one of the only things we could do, but it's proven really successful every time. And it's great because we can then take the surprising amount of money we get from that and split it between multiple things. So we also have a scholarship that we run, and we try to send 1 or 2 students every year to a conference that has to do with One Health. Last year that was the CAVE PM conference here on campus. And then we also used some of those funds a couple years ago for the Iqaluit Humane Society, who needed to do some rebuilding. So it's great to be able to collectively pool some of these fundraising events and be able to split them into multiple initiatives rather than just focusing on one particular thing. In the bottom left, it's kind of cut off there, but something that we ran last year for our Bachelor of One Health students was just a free food and study break. We know how hard it is, especially for early undergraduates, to be going through their first round of exams. So we wanted to try and engage them and talk with them and just have them relax for a bit. And we're really looking forward to all the things we are hoping to do with the Bachelor of One Health students this year. And that will bring me to kind of where we are headed, our future directions, and more just our goals, which are, of course, like we have internal goals and we have external goals. Internally, we're always looking to work towards a more cross-committee collaboration type setting. we're an interdisciplinary group by nature. That's what One Health is, and we look to really implement that in our organization all the time. We also like to pride ourselves in equipping our executives and our team members in becoming leaders, and leaders in One Health for sure, but leaders of student organizations and leaders as people as well. We think that's a really important part because experience in a student organization is great, but preparing students to go out into the real world or into graduate programs and so on is also really, really important. And lastly, in terms of internal goals, prioritizing relationships between our different subcommittees is really key. And having a focus on productivity as well as collaboration is great in terms of being effective and efficient as an organization. Externally, obviously, our main focus is to increase the awareness and promotion of One Health locally and beyond, and promoting all these different transdisciplinary opportunities that are available, whether that's on campus or elsewhere. We also love to encourage collaboration, whether that's providing research opportunities or internships or just advertising these things between faculty and research labs to students. And lastly, what I've bolded there, because we're really excited about it, is engaging and representing the students in the Bachelor of One Health program. That will bring me to what I'm really excited to announce is that we are recruiting right now. We opened recruitment for this year last Friday. We're going to be running that until end of day Friday this week. There might be an extended deadline. And we're looking for probably around 10 different positions. And these are positions, as you can see, they're across all three of our subcommittees. So whatever you might be interested in, whatever you might be good at, whatever you want to do, there's probably something for you. I'd like to highlight that because we are a big committee, all of our roles are very low effort and low commitment. So there's probably time in your work week to schedule in some time for OHSC as well. If you are interested, this is open, of course, to undergrad students, graduate students, and DVM students. You can follow the QR code there. You can find us on social media, which I'll show you in just a sec. Our email listserv, you can find us any way you can. And it's just a Qualtrics application. There's no interviews. It's very low stress. So I definitely encourage everyone to apply. It's a great time. That is everything I have for you today. So I hope you kind of learned a little bit about who we are, what we do. I look forward to seeing some applications, hopefully, over the next week or so. But yeah, you can find us One Health Students U of G is our handle on Twitter, Instagram, and Facebook. And our email is more or less the same at uguelph.ca. Thank you very much.
Hi, everyone. My name is Andrea Paras. I'm the director of the Guelph Institute of Development Studies, which is on the other side of Gordon Street, in the McKinnon building. It's quite wonderful that we are able to collaborate with the One Health Institute to present this event. So thank you very much. Or to Catherine and Peter and Jane for all of the hard work you put into making this happen. I want to begin by acknowledging that the University of Guelph is situated on the traditional and ancestral territories of the Mississaugas of the Credit. It's also located within the territory that is governed by the Between the Lakes Purchase, which is otherwise known as Treaty 3. And that was a treaty that was signed in 1784 between the British Crown and the Mississaugas of the Credit. But before that treaty was signed in 1784, there was already a treaty called the Dish with One Spoon Treaty that was negotiated between the Haudenosaunee and Anishinaabe peoples that committed them to living peaceably and in good relations with each other. And over the years, newcomers who have come into this territory have been integrated into its terms. And that treaty requires us to take responsibility for being good stewards of the land and for creating good relationships with each other, with our human and non-human communities. And so it's within the spirit of that I'm really pleased to welcome our panelists to this event on youth directions in Global One Health. Because what else is One Health other than thinking about how we live in good relations with each other and with the environment around us. So we're really fortunate to have two really wonderful guest speakers with us here today. And so I'll briefly introduce both of them to you. Dr. Dominique Charron is the visiting professor in One Health ours right now, which is great. Previous to this position, she was formerly the Vice President of Programs and Partnerships at the International Development Research Center in Ottawa. She is a member of the One Health High-Level Expert Panel, which was established by 4 global partners, which include the Food and Agricultural Organization, the World Organization for Animal Health, the United Nations Environment Program, and the World Health Organization. And so you'll hear people talk about the Quadripartite, and it's those 4 organizations that belong to the Quadripartite. And this One Health High-Level Expert Panel developed a working definition of One Health, which was endorsed by the 4 global partners, and it brings the conversations that we have today about One Health. I'll invite Dominique up here in a moment. Before I do that, I'll also introduce our second speaker right now. Our second speaker is Dr. Nitish Debnar, who's joining us. You'll see him on the screen momentarily. He's joining us here from Dhaka, Bangladesh. Dr. Debnar is a veterinarian. He holds a PhD in virology from the University of Sussex, an MSc in tropical veterinary medicine from the University of Edinburgh, and had his postdoctoral training on non-specific immunity in Japan. So Dr. Debnar pioneered the formation of One Health Bangladesh in 2008 as a civil society One Health platform for Bangladesh. He has been involved with many national and international research projects on animal health and veterinary education. From 2011 to 2018, he worked for the Food and Agricultural Organization at the United Nations as a technical advisor on One Health. And since January 2020, he has been working as team lead of Fleming Fund Country Grant to Bangladesh, and is one of the 26 members of, along with Dr. Charron, the One Health High-Level Expert Panel. So we have 2 global leaders here with us today in One Health who are going to share their perspectives on the current state of One Health and where it's going in the future. So I'd like to welcome Dr. Charron up to begin.
Great. Thank you. So I'm going to have 2 double screens. Thank you. Thanks so much, Andy. Really a pleasure to be here. And I, too, am going to find it exciting to be better than Britney Spears with 2 mics and a little bit more clothing, which I'm sure is a relief to everyone. It's so nice to see you, Nitish, online, and really great to have this opportunity to share this time with Nitish and with all of you. Also, I'll just add to Andy's acknowledgement. So I live most of the time in Ottawa, which is on the traditional territory of the Anishinaabe. And whenever I go anywhere, I always ask, where am I? Whose is this? Who is here? It's really an honor because Guelph is my second home. I'm also a graduate of the University of Guelph. I did my DDM and my PhD here, so it feels, and lived here for 20 years. My son was born here, so it feels like my second home. And for me, the reason these acknowledgements are important, and not just to say it and move on, but to think about it, as a scientist, for me it's about not only reckoning with my settler history and coming to terms with the impacts of colonialism and the coming of Europeans to Canada and what that's done for our Indigenous peoples, but it's also, as a scientist, opening my mind to wider understanding of knowledge and being inclusive about forms of knowledge, and that's a challenge for us scientists. And so for me, that's part of my journey as I walk this path of reconciliation. And so thank you, Andy, for that acknowledgement. Now, I'm going to be driving 2 slides here. Oh, right. So this is New Directions. As you heard, Nitish and I are both on this high-level panel, and some of the conversation we're going to be having today refers to some of the work of that panel, and we advise those international organizations on how to move forward with implementing One Health. And my part of the, going the wrong way. My part of the talk is really about the policy type of framework. But before I go into that, why are we talking about this now? Why is it particularly important? Why are international organizations and governments around the world actually talking about One Health? They weren't before. And I think there's never been a more important time than right now to be thinking about these ideas and really changing or even overturning the apple cart of business as usual to tackle the intersection of health, environment, animal health together, and to do it differently than what's been the status quo. Just look at the headlines, this slide. You know, our country is on fire. Many parts of the world are experiencing climate extremes that they've never experienced before, floods, and we see that the devastation that that's bringing on people's health, animal health, and the headlines are even going into that level of concern. And we also see and hear in the news about antimicrobial resistance. It's an area of expertise of the University of Guelph, but it's also a growing threat. This slow creeping pandemic threat of running out of tools to fight infections that used to be very easily controlled. And then we also have the challenge, we've all come out of the COVID pandemic. Yes, we'd love to put that in the rearview mirror, and it is receding in the rearview mirror, and we are trying to grapple and learn lessons, but we have a global spread of a very pathogenic avian influenza that's now spreading into many different types of mammals. They're getting it from eating dead birds, seals, coyotes, pets. And this increases the risk that this strain of influenza can be transmitted more easily to people. So we can't let our guard down. And the things that we have done in the past are insufficient. We know, we saw COVID, it's not enough. So that's why we're having this conversation. That's why global frameworks of policy are important, to think about how we can change the way things are done. Policymakers are grappling, particularly in the wake of COVID, with how to do things differently. And the idea that we need to work differently across sectors where the potential emerging diseases may come from animals, whether it's wildlife, domestic animals, and how to get people to work together better to address where these things are coming from and prevent them. And if they are spilling over into either domestic animals or people, then how do we respond better to make sure we have a more effective, equitable, and effective response. Several processes are currently underway now that will have an impact on our ability to do that globally. They will create demand. These processes are going to create demand for the skills that you are gathering and acquiring here. Right? This is the world you are going into is going to be much better prepared for you than it was for me, put it that way, with an interdisciplinary skill set. The ability to build bridges across sectors and disciplines will only become more important. The ability to see problems that may look like an environmental problem or a veterinary animal health problem or a public health problem, to see them in a context that's related to climate change, that's related to social inequality. That is going to be extremely valuable. And being able to come at things with that lens that the solution, there may be technology involved, but the solutions to these problems are going to involve people and people behaving differently. And that's why policy is important. Next slide. Yes. So this is what some of the things that are going on right now that are happening at a global level that have direct or peripheral One Health implications. We've got, since about 2015, a global action plan on antimicrobial resistance that does have a One Health dimension. Antimicrobials that are used in animals, even though it's greatly reduced in many parts of the world, still have implications on resistance. And of course, people misusing antimicrobials has implications. And we're learning also that once these antimicrobials get out there in the world, into ecosystems, they spread. So we're finding antimicrobial resistance organisms in wildlife in the Arctic. Now, there's not a lot of antimicrobials up there, so they're getting it through food chains. We have the G7 and the G20 who have come out over the past several years, even before the pandemic, with commitments to moving forward in an integrated way with a One Health lens. Right now, since 2022, countries have been negotiating a pandemic treaty, a pandemic instrument that's going to help better prepare the world to respond to another public health emergency, more equitably include poorer countries so that we don't have the kind of me first, only me first attitude that we had through COVID. There is what's called a financial intermediary fund, which is a fund of the World Bank in which donor countries contribute to help support preparedness, including One Health, in countries that don't have the means. And then we have also the work of that Andy alluded to, that Nitish and I have been involved in, which is supporting the UN agencies and the World Animal Health Organization. Now, I'm sorry, somehow this got out of order, so bear with me. I'm going to zoom into what's called the Joint Plan of Action for the on One Health, and this is the plan of action of these 4 UN agencies. Now, it's important because once they have a plan of action that's been ratified by the agencies, boards, and the member countries, then they access resources to implement this. Now, the agencies need to implement it themselves, so they need to strengthen their own capacity to work across, but then they also have resources to support countries to implement. And that's important. When you have a policy framework, then you have resources and you can support implementation. Now, you've heard already about who the partners are, so I won't talk too much more about that. I will say that the desired impact of this is quite ambitious, and it is a product of the pandemic, so it has a very disease prevention focus, at least in its goal, which is to be better able to prevent, predict, detect, and respond to health threats, all health threats, and improve the health of people, animals, plants, and the environment while contributing to sustainable development. Very lofty. I'll go into the action, I'll go into it a bit more here. And the reason I'm going to go into this a bit is because understanding how these big policy frameworks work and how they can help enable the implementation and draw attention to how you actually go about doing this in country is really helpful. Without that, you have everybody going off in their own direction, trying things with more or less effectiveness, and the countries can't necessarily compare or speak to one another about how it's going. So having a framework does help, and I'm sure Nitish will be able to say how Bangladesh has already been doing this and how they are responding to the Joint Plan of Action. Here you see the parts of the Plan of Action. I'm going to spend a bit of time on the theory of change and the framework itself. And the reason I'm going to do that is because a theory of change, for those of you who've never heard that term before, is a conceptual framework that helps you say, this is where we are now, this is where we want to be, and these are the pathways that we will take to get there, and the specific actions and objectives on each of those pathways. It's a pretty technocratic way of viewing a set of objectives, but because it has these specific milestones and little objectives, it's measurable, and you can hold agencies, governments to account because they have published this and they say this is where we're going, this is what we're trying to achieve. And it also helps them focus attention on the areas that aren't moving as fast. So on this slide, you see a diagram of this theory of change. The pathways I'll just describe in a minute. That was the slide that was out of place a few slides ago. The action tracks, the 6 action tracks. But just to give you a sense that we may be working on different things like antimicrobial resistance or risk of disease spillover, but in any case, we will be looking at pathways of policy, legislation, financing to support implementation, or a second pathway around capacity building, organizational development, and implementation in country. And a third pathway where research comes in, which will be of great interest to many of you, which is on the data, evidence, and knowledge. And so that helps us focus on each one of these 6 action tracks, these pathways of change. Now that middle piece that you see in the graph that's too small to read is in the action, in the document itself. You can read all of those objectives. And then you see we're going in the medium term to some improved coordination, communication, organizations doing a better job, then the longer term outcomes, which are more lofty, and then ultimately leading us to that world better able to prevent and predict and detect and respond to health threats. So that's the theory of change, and you'll see these again if you dive into policies and frameworks and so forth. It's a helpful thing to know about, and this one I kind of like. So the action tracks, just to give you a bit more detail on those, there's the first one, which is across all, which is to build capacity and build the workforce and create that enabling environment so that people with these skills can apply them. Reducing the risk of disease emergence, addressing other types of health problems at the intersection of animal health, human health, and environment, so vector-borne diseases like Lyme disease, controlling and eliminating other kinds of parasites and neglected diseases, fungi. And then action track 4 is about strengthening and addressing food safety, specifically with the One Health lens, and dealing with antimicrobial resistance, as none of us are surprised to see that there. And then a special extra attention, although it shouldn't be off on its own as an action track, because environment is part of One Health and should be in all, we need special attention there because it hasn't always been so. A lot of One Health in practice is human-animal stuff, and we're missing that piece on biodiversity, that piece on ecosystem sustainability, the pieces that focus on the integrity and health of the environment. And so how we strengthen that in our One Health practice is an action track. There we go. Soon, during the climate conference, the UN agencies will announce their implementation guide for this, which will help countries then figure out how they actually put this in practice. They will be focusing on the pathways of change. And you see here some principles. So it needs to work in the local context, needs to be applicable, it needs to be flexible and adaptable. It needs to be aligned, obviously, with the goals of the global goals of the plan. It's not going to happen overnight, so planning how to do this in a stepwise way. Start with an assessment, start with a current problem. Maybe there's a real problem with brucellosis, which is a disease of ruminants that can be transmitted to people, causes abortion and other performance issues in the animals, and can be similarly a problem for people. So start with the real problem. Don't start with preventing disease X that doesn't exist yet. Start with the problems that people have the evidence, so gather the data if it's not there. Don't forget about equity and inclusion and multi-sectoral approaches to make sure that the voices that may not be at the table are represented, and the picture of the complexity is as complete as possible. And then do it systematically so that there's an accountability framework and follow-up with measurement. So that's coming, and there may be quite a bit of fuss. I heard that at the climate conference, which will be in Dubai, which is centrally located, if not the most obvious place for a climate conference, to discuss a lot on One Health. So there may be quite some activities there later in November around the climate conference. So I'll leave you with a few considerations. So this is great. We have a joint plan of action that's never existed before. There will be resources to support countries, we think, we hope. The UN is on this with the World Organization for Animal Health, which is technically not a UN organization. It's taken quite a while to get here, and the world is on fire. We're on fire, other parts of the world are on fire, and metaphorically speaking, the climate crisis is not going away and not slowing down. So policy processes take time, and this can be quite frustrating. We do not yet have, in all contexts and in all countries, the adequate expertise, resources, financing, and support to implement. It's going to be hard to keep countries focused on implementation of One Health and being accountable for that, because real life will intervene. Other priorities will happen. I mean, I can't imagine having a conversation with the very fragile two governments in Libya about One Health right now, because they've just lost 15,000 people to a flood. Now, yes, it's related, but their entry point for this will not be a complex framework. Right? Their mind is going to be on other issues. So those are challenges of implementation that your clever minds are going to have to help us grapple with as you move into this workforce. And I'll leave you with what I started with, which is there has never been greater demand for these skills. There has never been a greater need for this type of work. And I'm sure Nitish will tell us more about what that's like really in a place like Bangladesh, and why maybe in Bangladesh they've been able to move forward with implementation of One Health in a way that's moved faster than perhaps in Canada. So I'll leave it at that, and I will thank you for your attention and hand it over to Andy, I imagine, or is it just, we're going to go straight to Nitish?
Hello, everybody. It is midnight in Bangladesh, so I would like to say good evening and good morning, whoever, or good afternoon. And thank you very much, first of all, to the organizers for inviting me to this important event. I am very honored to be here with you. And in particular, my friend Dominique has given a very excellent overview about the One Health, what is happening globally, and what has been happening with the joint plan of action. And what I will do here with you today, I will share my experience of One Health in Bangladesh. And, this is what is my task to tell you. But more importantly, you might not know much about Bangladesh, so I'll just introduce a little bit about Bangladesh. This is what is my outline of my presentation. I'll tell a little bit about Bangladesh and its progress and challenges, and how we conceive the concept of One Health in Bangladesh. How is it getting institutionalized in Bangladesh, particularly with the policy influence and the governance. And we will also talk a little bit about One Health in action, particularly in terms of controlling diseases, community engagement, capacity building, and how is it impacting the One Health practices, and also what lesson we can learn from the implementation of One. And just I want to show you this particular picture here. This is our national animal, the Royal Bengal tiger. And when I talk about Bangladesh, I just want to show you how the progress we are making. Bangladesh is relatively a new nation. We started our national journey in 1971. We liberated in 1971, and we just had our 50 years birthday of the nation. And when it emerged in the world, it was one of the poorest countries. And now what you can see here, we are in a very historical juncture. We are a least developed country, now we are graduating to a developing country. Our poverty reduction has gone 40% to 40%, and increases across the 5 components of the human aspects index, particularly infant mortality, maternal mortality, undernourishment, adult schooling, and adult literacy. And that's what exceeds the threshold of this index for the first time in 2016. And the food security has significantly improved, and that's what you can see in the slides in the left side and the right side, and you can see how the economy is growing and per capita is also growing. And mainly the important indicators that the agriculture is still playing an important role, and we are contributing almost 40 to 50% of the GDP, and 44 billion in costing US dollar. Manufacturing industry is also growing almost 100 billion, and service industry is also growing very well, 52%. We have also a very strong garments industry, almost 30 billion. It is known to be a second biggest industry for the country and globally. And also we had a very good support from the remittance. This is 8th country in the world. And this is one of the comments about the economy of Bangladesh. Bangladesh is known for its remarkable progress in reducing poverty and creating opportunities for its citizens. It is among the 10 fastest growing economy in the world. This is the comment made by one of the World Bank leading personality, who is the director of the strategy of World Bank currently, and he was also for a time in Bangladesh as a country director. Having said that, I would like to mention some of the challenges and which has driven us towards One Health. First of all, the Bangladesh is one of the country of highest human population density. And as you can see here, it is a small country, only 56,000 square miles, and it has a population of 169 million or something around that. And it is, as you can see in the graphs, how if you compare with the other countries, how the density is in Bangladesh. It is not only the human population density, it is also when you think about urbanization. Bangladesh is also growing too much of urbanization. It is almost nearly 40% of the people now living in the urban area. This is what also one of the important picture of Bangladesh. And feeding all those people is always a challenge. And for that reason, our agriculture is getting very intensified. And that's one of the reasons why we have to be very careful about our own health population. As you can see here, rice is a staple food. And it has become triple rice production in our country after our liberation. And it is not only this, the other 2 crops that I will be mentioning to you, chicken and also the fish, sweetwater fish or aquaculture fish, are of the very fastest growing crops in our country. And that is also one important thing to consider. As a result of these things, proximity with the human and animal population is very close. It's not only the livestock or food producing animal, it is also very closing. They are getting closer to the wildlife as well. And having said that, Bangladesh is also having a very complex river system and very environmentally vulnerable country. It's a unique geographical location. Its dominance of floodplain, drainage ecosystem. It is a delta, as you all know. Water is coming from upstream from Himalayas, and the sink of this coming here. And this is how the water coming. It's not only water that's coming; it brings a lot of other things as well. And this is one of the complexity of the country as background, if you see this picture, you might have known about this picture very well. There are four important areas of emerging infectious disease: zoonotic pathogen from wildlife, zoonotic pathogen from non-wildlife, drug-resistant pathogens, and vector-borne pathogens. And if you see the picture in this graph, in this map, all the red spots, Bangladesh is having the red spot area. And maybe if it is the latest one, even more red spots you will be seeing in the globally. And Bangladesh is one of the hotspot for that thing. And with this background, now I'm going to tell you how we really conceive the idea of One Health. Look at that, what happened, during the first decade of Bangladesh. We got UNEP, and there is a heavy, very extensive epidemics in 2003 to 2005. We also got avian influenza, as Dominique has already mentioned, how avian influenza can be a potential pandemic pathogen, and this is what emerged in Bangladesh in 2007. We also had a food safety issue with melamine during that time. We also suddenly what happened in 2009-10, we got a long, extensive outbreak of anthrax, which is a sort of endemic zoonotic tropical, zoonotic diseases. With these things, there was a panic in the country, and for the first time, sort of multi-sectoral collaboration to prepare the pandemic, avian influenza pandemic preparedness plans in a very collaborative way. But when this disease comes in 2007, I was the Vice Chancellor of Chittagong Veterinary and Animal Science University. Farming community people came to us how we can deal with this avian influenza situation. And we had a very strong discussion with our faculty members and our farming community members. It's not only avian influenza, it is beyond avian influenza, and new things can come on what else we can do. So we discussed these things with our public health colleagues, particularly Institute of Epidemiology and Disease Control Research, which is one of the best institute of public health in Bangladesh, ICDDRB International Center for Diagnostic Research in our university. And we had a very strong discussion among ourselves how we can promote One Health agenda in Bangladesh. And then we engaged some more consultation with UN bodies, universities, research organizations, NGOs, and civil society. And what happened, based on those brainstorming, telling you that, we organized the international conference in Chittagong in 2008, and then the idea came up that let's move with the sort of formation of civil society platform, what we call One Health Bangladesh. That is the first milestone of our One Health journey. We made a Chittagong declaration how we can work with the One Health in Bangladesh, first with the civil society, with the concept that we'll be working with the government, with the other professional organizations as a whole to promote the One Health in different ways. And that's how we think. But one important target in that conference, as well as subsequent promotional activities, that we need to institutionalize One Health. The cousins silo system cannot really promote One Health. And for that thing, we targeted to go for institutionalization. And then in 2012, in January, we organized a sort of extensive collaborative discussion with our UN agencies, particularly FAO, WHO, UNICEF, and other development partners, including USAID. And we thought that we must go for a strategic framework and action plan for One Health. What we have already heard from Dominique, that we'll see how it has really link up with the current thinking as well. Let's say, when we organized this development process, we had a very strong participatory discussion with government partners, UN agencies, research institutions, universities. It was a very comprehensive strategic document that we embarked on. That is, we identified the goal, vision, attributes, components, what we achieve, and specific objective. It was very persuasive. It's a 5-year action plan we developed, and also it has an indicative part how we can assess that it is really working. With those 4 components, we developed a strategic framework. And then this, there are 9 components in the strategic framework. I'm not going to detail of that one, but it covers, from governance to wildlife, social economic aspects of disease, capacity building, strategic communication, networking, research, and most importantly, coordinated surveillance and coordinated outbreak investigation. Those were the components and guidelines for us, and it has been endorsed over a 3 years period of time by 3 ministries of the government: Ministry of Health and Family Welfare, Ministry of Fisheries and Livestock, and Ministry of Environment and Forest and Climate Change later on. And they were endorsed by them, and that document, based on that, we started to develop a sort of multi-sectorial coordination mechanism, which is given the governance issue, an interministerial steering committee for One Health. Another one is the technical advisory committee and One Health secretariat. And those are the, and we have decided to go for the functioning of those coordination mechanism. And this is how we, the first meeting that we have, interministerial meeting in 2016, we developed a, TUR, or Terms of Reference of One Health Secretariat. And these are the functions that we work on, including the multi-sectoral coordination, surveillance, capacity building, advocacy from the government side. And after 5 years, we revised this component to include the antimicrobial resistance. Originally, when we started this journey in 2012, we didn't include AMR, and we also included, 3-tier to 5-tier multi-sectoral coordination mechanism, and also the other ministries that we can include. With these things, I summarized the, policy implementation. In 2012, we developed a strategic framework. We validated this action plan endorsed by the government in 2015, institutionalized the multi-sectoral coordination in 2016, and then secured the financial support from the government in 2017. And how, One Health in Action that I would like to mention, these are the 3 approaches that make whole of a society, whole of a government, an active partnership with the global community. When we talk about the whole of a society movement, I just want to highlight that, we organized 11 One Health conferences so far, and you will see that how the number is increasing. When we started, it was 250 participants. Now, in this year, in 2023, the number of participants from multi-sectoral participation, we have more than 1,000 participation in Dhaka. We had a 3 days conference. And this is how we work. We engage different communities, 3 extended seminars, annual general meeting. We have 150, 500, or 1,500 members of the One Health Bangladesh. This is how it is working in Bangladesh. We prioritize the zoonotic diseases. I'm not going to tell about all these things. This is one exercise we did. We developed a sort of One Health integrated surveillance for avian influenza, Nipah, as well as anthrax. And we work with a partnership with different organizations, both from the government, UN, and other partners as well. This PD also works in Bangladesh for surveillance, human and wildlife interference, and joint outbreak investigation for Nipah, for avian influenza, for anthrax, those who are going on, and for the management. And One Health dashboard, event-based One Health, dashboard for zoonotic diseases has been set up in the One Health Secretariat. It is not only that one, also AMR surveillance is also going on a One Health basis. This is the structure that we follow for that. Most importantly, that we have also developed a dashboard, a National One Health AMR dashboard, which is really supporting our clinicians, policymakers to make decisions and for antibiograms and other things. And One Health in Action also the community level for AMR. I'm not going to detail that, but these are the approaches that we are making. We have a mass dog vaccination all over the country, jointly organized by Public Health Department, Department of Nitrogen of Health, and Department of Livestock Service. We have also we have been working on One Health human resource development, particularly with FETP and FETP-V. These two programs are synergizing for One Health capacity building. One Health fellowship program will do, or sometimes One Health simulation. Most importantly, Chittagong Veterinary Animal Science University has established a One Health Institute that you are working like just like that, and also introduced a postgraduate degree, not as the bachelor degree. And networking with the international partners, we're not going to talk much on these things. These are the partners that we work very closely. And also the Chatham House, we have a research organization where One Health Portia, what we call UK Research Innovative Fund, 4 countries, and Bangladesh is one of the pioneering countries to implement that One Health research project, out of which we get a lot of benefit to control zoonotic disease that can spill over from poultry. And what is the impact? HPI, this has gone down much. NIPA, from between 16 to 2018, we do not have a NIPA nowadays, although sporadic, but a lot of, social awareness as well as a lot of activities in the zoonotic disease, like NIPA is going on, and we are remaining in the control condition. Rabies is also going down quite a lot. This picture shows that one. Anthrax is also going down quite a lot. And most importantly, this whole of the society, government, and all of the government approach, what we are doing, these activities that I have already mentioned. But 6 important things has emerged out of that. One, the coordination with the government partners and others. Second, outbreak investigation and surveillance, and the lab networking, and also research institutions, and those networkings are growing. One Health capacity building programs are in place, and also multidisciplinary research are also going on, and also conference, seminars, dialogue. These are the regular community engagement activities are there. With these things, what lesson we learn? This is what is the model that we would like to propose. We are independent silos now. Because of our self-awareness, the relationship is growing now. The ownership is developing. We have a framework of actions and continuously acting, sharing all these things. We have One Health Bangladesh, formed in 2000 now, is an active community of practice, our civil society organization, our think tank. One Health Secretary has become a very functional government entity to support One Health activities. We have also One Health Young Boys, just like student activities, and also university network, and One Health Institute of Chittagong Veterinary Animal Science University. At the end, I would like to say that Bangladesh has successfully moved forward to institutionalization of One Health. One Health Bangladesh and One Health Secretary has mobilized professional network working hand in hand. There is a regular engagement with the government, and current institutionalization mechanism must go from down to sub-national and community level, and government must ensure steady funding for this one. And as Dominique has already mentioned, we have also adopted one theory of change for One Health in Bangladesh. I'm not going to detail up, but that is the exercise we have already done for Bangladesh. Ladies and gentlemen, that is the experience that I have shared with you right now. And if you have any question, I'm very happy to answer any questions there. Thank you very much. Thank you.
Great, thank you so much for Nitish for taking us through the experience of Bangladesh. We're now going to open things up for question and answer. So we have lots to talk about. Perhaps while you're thinking about your question, I'll start us off with the first question, and then I'll return to you, and we can go that way. So, and maybe I'll ask Nitish this, but maybe Dominique can also kind of add in things from the Canadian perspective. Nitish, you spoke about lessons learned in the experience, and that came closer to the end of your presentation, but I'd like to return to that question and ask you, what can we here learn from the Bangladeshi experience as we move to implement One Health in Canada? If you could boil down your lessons learned and give us some advice.
Well, I can share one thing, particularly from Bangladesh perspective, that, the strategic framework that we developed a sort of guideline, national guideline we should have in all countries. That is what is the advocacy now coming up from the Joint Plan of Action as well. If you see this, the first track of the pathway, 3 pathways, one of the pathways to advocate the policy for a One Health policy for each of the countries. That's what they are focusing. It is not necessary that what the strategic framework and action plan will develop, you will have to follow that one. But what is very important, that a sort of policy guideline each country should have. Maybe you can start with that one, and then you can really focus what is your priority. In our country, we have a different priority. You may be having a different priority for your country. But I think that would be the first beginning for a system development. And as you know, I would like to add this point that we are very accustomed to work in silos, and One Health is supposed to break that silos, and that is the most important thing. That one, and when I was listening to your dean in the very beginning, I can see that you have already started that one. I'm very impressed that the academia, the way you are coming up, and perhaps you are the first university that you are opening a sort of bachelor degree in One Health. These are all very new lessons for us, but also you can learn something from others. Thank you, Over.
Do you have anything to add, Dominique?
Yeah, thank you. Oh yes, we have to share this little microphone. Thanks, Nitish. I think it's very astute. So it's interesting. The landscape in Canada is, Andy and I both, as you were describing how far Bangladesh has come, and we said miles ahead. Bangladesh is miles ahead of Canada in terms of a formal One Health framework and structures and financing and so forth. There's some reasons for that. Of course, health, public health, and veterinary and agriculture and environment are shared responsibilities, Canada being a federation, quite decentralized between the provinces and the federal government. So there's some challenges there that would have to be addressed, and have been successfully with the launch of the Pan-Canadian Action Plan on Antimicrobial Resistance, which has a One Health lens. But it has just been launched in 2022 or even earlier in 2023. So you see, I think in Canada, we're behind on this front. What I recognize as well in Bangladesh was the clear need with some of the issues and major national public health, environment, animal health problems, the threat of the Nipah virus, which is again circulating in Asia these days. It's a very fatal disease and quite worrisome. The stuff of movies. And yes, we've all lived through COVID, but imagine COVID much worse. So those kinds of problems, I think, tend to bring decision makers together. And we've had that in Canada in the past with the mad cow disease problem that we had here with even our first SARS outbreak in 2003. And also I would say, the good luck and low budget solution of co-locating the animal health and public health high security laboratory in the same place in Winnipeg. And that has created opportunities to share data, to share information, and to build collaborations. And there's an expression in English of necessity is the mother of invention. Well, it is. When people have to work together to solve a problem and they need each other's expertise, they will come around the table. And when decision makers, heads of state, heads of ministers, and heads of departments need to show that they're doing something, that opens the space to say, hey, we know how to do this in a way that's going to be more effective. But in order to do that, you have to have those relationships with the decision makers. You have to have the channel to bring either from the research community or from the policy community or both the solutions. And if you only wait until the decision makers ask for it, there isn't enough time to build the solutions. So it really is a bottom-up and seize the opportunity kind of moment, which we have on antimicrobial resistance. And hopefully with this global process, policy process on One Health, there will be a similar, hello Canada, where's your One Health action plan? And somebody somewhere, it's going to wind up on someone's desk, right? You have to do this. And hopefully that will create even more opportunities for a much more participatory, consultative conversation as Nitish has described. Sorry, long-winded answer.
Great, thank you to you both. Okay, over to you with your questions. And I think maybe what I'll do is I'll come to you with the mic so that I don't have to repeat the question, and then I'll come back, and so Nitish can hear us. So who has the first question?
You can ask us anything. It doesn't have to be on the topic of our of our presentation.
Okay, great. I'll come over.
Hi, I'm Natasha. I'm doing a One Health specialization, hopefully collaboration for my master's project. Doing a master's in epidemiology, I'm looking at access to veterinary services for bison producers. More close. I speak really loud though. Okay. So my question was just kind of building off what you just said there, Dominique. That you said that One Health initiatives sort of come from a need. My question is, do you think that we should be trying to, instead of just reacting to a need to collaborate, like that forced collaboration in a way, that we should try that more preventative, like trying to get ahead of the need? I don't know if that makes sense.
Mm-hmm. Mm-hmm. Thanks, you're going to get your steps in today. Thanks for the question, Natasha. Yes and no. I would say often when you're dealing with a situation, so for example, bison producers, they're going to be aware of risks that their flocks, herds face, and the possibility of introduction of diseases that are circulating either in wild animals or in cattle, and vice versa, right? If I'm remembering the bison situation correctly. So there's an awareness there, and there's probably a demand. So bringing the public health folks in may be the harder pull. And always with these sorts of things, we need to consider for the stakeholder, what's in it for them? What will they gain from this? Even if there isn't a problem yet, they will gain knowledge, they will gain access to data and information that they might be able to use, and they will gain an understanding of a new problem that perhaps they might have to deal with down the road. So I think for the front line, it's more obvious how to bring people together around a problem that's likely going to be fairly relatable for the frontline folks. Where you get into more barriers is when you go up the line and look for resources to help support action. That's where the folks who control finances will say, I've got bigger, more present problems that I'm working on, so why would we fund this? Why? And that's where your local stakeholders have to do the advocacy with you to help bring the resources in to actually be able to do something to prevent the problem. And perhaps Nitish can comment on this as well, that when you bring people together to talk about these things, it tends to be quite intuitive and there'll be lots of uptake. The problem becomes in sustaining it, particularly if you need resources.
Nitish, would you like to add anything?
No, I think Dominique has given a very good answer to this question. But yes, I mean, it is a process that you have to follow in a very sustainable way. It is not only the finance, it is also the issue of sustainability of engagement. That is most important. And champions are needed in that process of, establishment of One Health process, because, we developed a system over the centuries. Now we are trying to break it, and we are coming to closer that collaboration is essential for the complexity of the problem that we are facing at the moment. And you are very right. And for that thing, it is not only the reactive one, a natural way of to go for this sort of collaboration will have to emerge. And for that thing, you need a very strong advocacy. And I believe that, when I was listening to you, young guy, the student committee, I can see that commitment is there, and you need to really pursue these things in a very persistent way. Never get frustrated, Yeah, there are a lot of, barrier for that, but you have to continue. I wish you all the success.
Thank you. Next question. Okay, I'm getting my steps in. That's great. Going all the way to the back.
Thank you. My name is Michael Brunt. I'm a postdoc here at Population Medicine. I'm just wondering, I think, Nitish, if you could comment first on the problems we're trying to answer here are extremely complex and very messy, that don't have simple answers. And quite often, whenever a policy window opens at a government level, these policymakers are looking for a simple answer that is able to just solve the problem that they need to get solved. So with these problems, the research is often needs to be multidisciplinary and bridging lots of different ways of creating knowledge. And I'm just wondering if we could start off with your example of how you've been able to maintain this multidisciplinary approach in Bangladesh, and then maybe we can comment on the Canadian context as well in our infancy.
Yes, thank you very much. Basically, as I mentioned in my presentation, thank you very much. It's a very good question. And we are also struggling, not necessarily that we are, over successful or the best successful example I can cite, but there are three examples that I will certainly share with you. One, when the avian influenza issue came up, basically, we have seen that, it's both from the human health side, from animal health side, and resource mobilization from the development partners were coming. And we utilize these things, particularly with some motivated people, and they did produce some good things that they are very useful, particularly at farm level, at management level, and they are happy with these things. Same is the case with the Nipah. One of the best examples that we have cited in Nepal, that when we, our Nipah is not just like Malaysian Nipah. The Malaysia is transmitted through animal like pig population, that thing, and we are having by the palm Sept. And a very strong multidisciplinary team worked with that one to identify that what is the source of that virus coming from. And then we identified the case that of the coming from the bat. A very strong group of people working behind this thing with the veterinarians, anthropologists, public health specialists, virologists, and finally they were able to identify this thing that it is basically directly coming from the bat to the pumpkin. So this is one best example that I can cite. Similar thing happened with anthrax as well. Anthrax is a very old disease, but how is it transmitting in Bangladesh context? We have seen that animals are dying from the anthrax, and people are basically killing them well ahead so that they can get pay out of that, and they are selling the meat to their people, and then it is transmitting from animal to human being. And it has been identified by a group of investigators, anthropologists, veterinarians, and also the public health specialists, those people. So these are the few examples we created there and draw the attention of the policymakers, not only the policymakers, also the professional group of people. Look, this is how we can really work together to create best example, to show the pathway of solution. So this is what we are getting. Now the problem that I have already cited here about the One Health Poultry Hub. We are using Poultry Hub research program to engage even even not only the policymakers or professionals. In this research process, we are engaging the producers. They are also coming and supporting us. So this is the experience that we are having at the moment with our research finding. And I think I gave some bit of answer to your question, but maybe Dominique can add to that. Over.
Yeah, thanks. Absolutely, Nitish. I think the point of being able to point to things that have worked. And I'd say in Canada, there are the examples I gave before where at the federal and provincial level, there had to be quite a bit of collaboration around the bovine spongiform encephalopathy, mad cow. There had to also a similar problem in deer that leads to possible Creutzfeldt-Jakob-like symptoms in people. So there are, and it's called chronic wasting disease of deer. So there are very Canadian examples of multi-sectoral collaboration to deal with a problem, and how the solutions and actions to help engage local stakeholders came through that multi-sectoral collaboration. That, I think, opens the conversation with stakeholders, with senior stakeholders, to say, listen, yes, this sounds like way too much to implement in a short time, very complex, but actually we have examples of this already in practice, where just a bit of strengthening of the governance and empowering of the people who are already doing things on the side of their desk, making it part of their mandate, hopefully with the resources, so that they're not doing twice the work, but it's possible to show the path. This is how we can strengthen this. This is how we can put it in place for the next problem we don't anticipate yet. And the argument, there's often, it's always about resources, right? There isn't enough funding or enough people or enough time to do this. So you need to show how to do it efficiently and effectively. Collaboration is not free. You're not already doing it. You know, if it's not already part of your mandate, it will take time, and it does take some resources. But it takes far fewer resources to build those collaborations in peacetime than it does to triple the size of your public health agency when there's an outbreak of COVID. So, you know, there are examples where it's possible to bring the arguments to policymakers and say, listen, it needs to be done. There's ways to do it that are efficient. It's a little bit more resources or reallocation of resources, but it can be done. And I think the work on antimicrobial resistance in Canada is a good example of the sort of national, not just the federal level, but all levels of government coming together to sort out how to better track and engage to reduce the misuse of antimicrobials. And I would bring it back to the international level to say the reason Canada prioritized that is that there is this commitment, and at every G7 and at every G20, there's a committee that meets with the health ministers and says, where are we on this thing? And Scott Weiss, actually, from campus here, is on the global leaders group that advises those leader conferences. So there's opportunities for research to influence these processes, not only through these lofty high-level panels, but through engagement with national and provincial and local stakeholders. And the other thing that I think is really important in Bangladesh is the role of universities and research institutes in having and convening those conversations locally with the stakeholders, whether it's bison producers out west or poultry or swine producers locally. And that engagement and the role of the university as a social actor in bringing people together around the necessity for invention, right? And doing things differently is important.
Thank you. Another question.
So my name is Susanna. I'm currently in the Master's of Public Health, and I also work at a local health And I'm just curious to know, with the Ontario Public Health Standards coming up for, they're going to be updated in the next few years, is there currently any work to maybe integrate more One Health approaches into the Ontario Public Health Standards?
I certainly hope so, but I don't actually know. But that exactly. So this is what I would see as a policy window. Here's an opportunity. There's a policy process underway. Like I was mentioning before, this pandemic treaty that was about vaccines and response and was ignoring One Health to a large extent. How do we get it in there? Who do we need to talk to? How do we show that by working One Health into the public health standards, we're going to be improving public health standards, and go about getting it in there at the top, because once it's in there, it's mandated, and then it's much easier for agencies then to allocate resources and implement.
But also goes back to your point about the complication in Canada based on our federal system and the division of powers between federal and provincial, right? So we have this patchwork. Another question.
Hi, I'm Kiana. I'm a PhD student in epidemiology, specializing in One Health. So one of the main things that we talk about in our One Health courses are the importance of transdisciplinarity within research teams. And I was just wondering, when do you know that you've achieved transdisciplinarity? Is there a cutoff of people from each discipline, or how do you know that you've really reached, I guess, saturation within that team?
Thanks, Kiana, for that question. No one's ever asked me that before. You won't know, and it probably doesn't matter. I wrote a chapter with good friend Margot Parks in a book about 10 years ago, more than 10 years ago now, that was short titled Better Together, the chapter, about transdisciplinarity. And the one thing I would say is critical is not only to do a multidisciplinary research, but to make sure we go outside of our academic or technical realm to bring in other perspectives from the community, from elders, from Indigenous people as relevant, and policymakers who are working in a completely different time space, very much shorter timelines than what we are accustomed to in research. And when, in my experience, when your eyes go wide and you're seeing something completely differently, then you're in the sweet spot. You may not have all, but your research and investigation will be going in a direction that is enhanced by that transdisciplinary nature. It's never perfect, and every project has its own rhythm of this, and sometimes they wind up being more interdisciplinary with each discipline, the anthropologists doing their thing and the epidemiologists doing their things and coming together and kind of comparing notes afterwards. And that's okay. And then sometimes it really is everybody together in the problem situation with the community, learning from each other and trying to sort it out. And that's great too, right? That's less replicable than the more sort of multi-sectoral, multidisciplinary approach. So, there's depending on the objectives, the scale, the scope of the problem, you're going to get to different levels. But that feeling of seeing something with new eyes, with fresh eyes, is a good, I find, indicator that something's going right.
Nitish, what would you add about transdisciplinary?
Okay, it's a very interesting question. I like the question very much. First of all, I would like to say one more additional point with Dominique. You know, when I was watching this presentation of your dean, I saw that the skill, the competence that One Health graduates will have to have. You know, this is the point that you need to learn and earn to recognize and to identify that how, you know, other discipline can contribute to your social problem. This is one of the skills that we'll have to learn. This is one of the skills that we'll have to provide to our One Health proponents, to our One Health graduates, to our One Health researchers. And that will be very useful. And you know, when we talk about multidisciplinary or interdisciplinarity, that sounds very interesting. But certainly, linking science is coming very popular. Just one example that I would like to share with you from Bangladesh perspective. When we were having this COVID in Bangladesh, you know, it was really a panic. And panic to the extreme. And then detect. You know, this is another slogan coming from the WHO. Then, you know, public health people came up that why not, you know, we had a discussion from the One Health platform that how we can support this government to the emergencies here. So the animal health laboratories came up to support the detection or the diagnosis of this disease. You know, that is one of the things that we did during that time. And this is how, you know, we recognize that the engagement of different disciplines is necessary to really deal with complex problems. It is not exactly a good answer for you, but what I can say that this is how people really get in touch, and that you really depend, as I cited in the NIPA problem, and similar things will come up again. So there is no bottom line. How are you to start? You have to find out your own way of getting in touch with the interdisciplinary group. Everybody will have their own way of coming together. That's what I would say. Thank you.
Yeah, thanks, Nitish. I mean, that's a really good example of how these existing relationships and ways of thinking and working, particularly when they're institutionalized in the sectors that we're talking about, lead to people thinking, oh, I should call my friend over in the animal health lab and see if they can actually do some testing. And the guys in the animal health lab, or women, might say, oh, we should call them, because they may not be thinking of us. But I think one of the skill sets that you can cultivate most is to stop and ask, who's not in the room? Who's missing? What might they bring? And even if it's not possible to engage them, be they another discipline or community, at least be aware that they're not there and how that might be shaping the research. And that reflex of asking who's not here is really rare. So, you know, as you go out into the world and think about who's not here, what might that mean, that will already be a huge contribution to the work you're doing and the activities that you engage in with others.
Thank you. Any other? Oh, I have to choose. I'll go around to this side, and then we'll get to your question next.
My name is Maimuna. I'm a Master of Environmental Science student, hoping to specialize in the One Health collaborative specialization. I have also worked for a long time in plant health with the CFIA and currently doing some short-term work with the FAO in plant health. So my question is in relation to the definition. I did read the paper from the panel of experts, and the definition is very integrated and very robust and explains a lot of transdisciplinary areas. I just wanted to know from the perspective of plant health and sustainable agriculture and environment, in terms of how well was that represented? I do realize that FAO was in the room, but I also realize that there was a lot of animal health, I would say, and maybe food safety perspective. So I would like to know, being there, being involved, how involved was the environmental, and I noticed previously it used to be tripartite and now it's quadri. I guess UNEP came in, so just wanted to have an idea of that background. Thank you.
Who would like to start with this question? Nitish or Dominique?
Maybe I'll give a quick start.
Okay, Dominique and then Nitish.
Yeah, thanks. So I'm jumping in because I wanted to really thank you for coming and thank you for your interest in One Health and how important it is that we have more engagement and contribution from experts in environment, plant, agriculture in the One Health space. It is absolutely dominated by human and animal health and is enriched greatly by an understanding of plant diseases, of the evolution of plant diseases, of the spread of plant diseases, the microbiology of plant diseases, and wider considerations of ecology and sustainability and ecosystem. And that it is very deliberately in the definition. We are hunting for case studies that show how actions on plant diseases relate to public health and animal health as well, and the sustainability of farmers, and this is more obvious. But I love the question, and Nitish, you probably have much more practical answer than I do.
Well, it's a very interesting question. When we started our One Health journey, we also engaged our plant agriculture colleagues as well. Interestingly, over the last 10 years, we didn't get much of contribution from our plant colleagues. It is mainly because we were dealing with the emergencies, which is really basically very visible, like Nipah, like anthrax, like HPI. There are nothing like, in the plant side. But I'm ready. The question that you raised is a very important question. Particularly if you think about the soil, the way we're using the soil at the moment and the plants that are growing on this particular soil, is it really good? The soil health is so important and we are not taking care of that one. And it is an integral part of One Health. And this is one important thing that we need to really focus on at this moment. Second point that I would like to highlight, anthropology, humans are abusing a lot of environmental issues, including using the antibiotics and going to the soil and coming to the plant, and finally it is coming to the food chain. This is also not only for animal, it is also applicable to the plant as well. So it is no way a negligible agenda, and that is why Dominique has rightly mentioned that the environmental threat that, out of these 6 has intentionally included there so that, the environmental side, including the plant, soil health, biodiversities and other issues are not excluded from the One Health. And those things are coming more and more, and I believe this gap will be filled up very soon. I have other examples. I don't want to take too much of time on this, but only answer to you that it will be a strongly integral part of One Health movement in the future, and no doubt about that. Otherwise, One Health will not be successful. Thank you.
I would say I'm still relatively new to the One Health field. I sort of stumbled across it in my 4th year of my undergrad studies, which was only 2 years ago, but I did it at a different university. And when I found out, I was like, oh, this is the answer to all our problems. Obviously, it's much easier said than done. But I love what's going on in Bangladesh. I didn't know that was happening, but it's phenomenal. And I am happy to be a part of it here at Guelph as well as part of my research. The problem is when I asked my professors about it, they had no idea what One Health was. Yet when I come here to Guelph, it seems like everyone knows what One Health is. And so my question is if you could comment on sort of the general perceptions of One Health and here in Canada and obviously in Bangladesh. Are people generally aware of it? Are they interested in it? Do they see the use of it? Or is it really just the people who are involved in One Health research and policy that are really just like spearheading everything, which is obviously important, but I'm just wondering about sort of the general public uptake of One Health.
Great, why don't you start, Nitish?
Yes, I would like to start with an example. When we organized this One Health journey in a conference, I invited a chief guest, in our country, a culture, to get a very important person. So as a university, we invited our chairman of University Grants Commission. His background is geography. And I told him that we are going to organize a One Health conference and I am inviting you to be a chief guest. Initially, because I am a vice chancellor, I requested the chairman of the University Grants Commission. He reluctantly agreed that, well, we'll be there. But what is it? He said, well, it's a multidisciplinary approach that we are making. I'm talking about 2009. And he said, well, I'm a man of geography. I never worked with a veterinarian. And what is the need of veterinarian here to invite somebody from geography, from sociology? These are the points. In a car, we were discussing this point. And I explained to him that this is what we're going to do. And I saw that he is not very happy with the explanation what I was telling. This is one example. Now, from that particular university, this professor is University Grants Commission chairman, but he is a professor of Dhaka University. Now, Dhaka University invited me to give a One Health lecture on coming next, on next Saturday. They were so much excited to hear about One Health. I'm going to give them a lecture on One Health. How is it progressing? So it is a 10-year difference and public perception. And I was invited. And the graph, the presentation that I showed you, when we started this journey, we invited a lot of people, 150 people came. Now this year, when we organized the One Health conference, the participation were 1,000. And we had to stop the registration in the middle, before the last day, because we were getting too many participants and we may not be able to accommodate them. So this is the change. And this change came through sort of engagement, as I say, persistently engagement. We remain. Sometimes we had a lot of, questions that people were very, very disciplinary based. They are not multidisciplinary at all. But I think the current time, even our Prime Minister, currently we're talking about One Health publicly, not even in a scientific community. When she was giving a lecture somewhere, and she talked about One Health. I was so impressed that, at that level it has gone. And our Honorable Prime Minister was, the co-chair of the Antimicrobial Global Leaders group. And she eagerly engaged with that one. So the understanding, both from the political side, from the professional side, as well as the young generation that is coming up, is growing. Yeah. And particularly with the COVID crisis, we learn more than anything else. So don't get frustrated. It will get sore because not only of the disease that we are talking about, it is more than that. Collaboration for our own benefit, interaction with different disciplines of the science, for our own benefit is going to be in a daily practice. That's what is my prediction with my 40 years of experience that I can tell you that it is going to be different days in the, ahead of you. Thank you.
Yeah, thank you, Nitish. It's a perfect, really, answer. It takes time. There's competition for ideas constantly. Yes, we collectively, all of us, need to do a much better job about talking about One Health and what it means and why it's important. And I go back to what I said at the end of my presentation, which is there's never been a better time. COVID has changed the world. Everyone has a better understanding now of how a virus, a human virus that has an animal source, stopped economies, took kids out of school. 2 billion children in the world were out of school for months at a time, and 1 billion still haven't gone back properly. The impact of that, the backsliding on gender equality, the backsliding on eliminating poverty, all of this impacts, and entire sectors haven't recovered properly from the pandemic here and in other parts of the world. So that changes, I think, the receptiveness of people to, like your chancellor of the university, Nitish, to say, oh yeah, I see how this could be relevant for, and how my discipline might have a contribution to make. The media are picking it up. I've seen some special discussions about One Health and taking an interdisciplinary approach, how that might make a difference. But it's a great opportunity. Branding it is not so important. If people say, what's One Health? They'll always say, what's One Health, or what's eco-health, or what's planetary health, or all of these different codes, concepts. But I think to say, listen, we know that the sustainability of our planet, our health depends on that. Our health depends on the health of animals and the health of the environment around us, and it's interdependent. So animal health and the environmental sustainability depends on actions by people. And that's what this kind of framework is about, looking for that way forward to promote the health of all of that. Though there's trade-offs in there, but there's also new pathways forward that don't lead to one necessarily being damaged, the environment or animal health or human health because of work in another sector. And that conversation, I think, because of COVID, whether it's here, whether it's in Senegal, we have one participant with us who was in the chat from Senegal or Bangladesh, there's a new awareness of why that's important. And COVID is one piece of it, the climate crisis is the other. And taking all that together, I think there is a greater opportunity to have those conversations and move these ideas forward.
So that is a perfect place, I think, to conclude this conversation. Thank you, Nitish, for staying up really late to spend some time with us.
Thank you very much. I really enjoyed it.
And thank you, Dominique.
Thank you.
And the conversation's just beginning. So have a wonderful day. Thanks for coming.
Thank you.
Bye, Nitish.
Thank you very much.